Ah, this is voice. And me telling you that this is voice is speech. Do you see the difference? Voice is sound produced through the voice box, the vocal cords, the larynx. In medical terms, this is called phonation. And me talking to you and you being able to understand what I'm saying as long as we speak the same language is me using what is known as speech. Voice produced by the larynx or the voice box gets modulated by lips, teeth, tongue, hard palate, soft palate, nasopharynx, to some extent nasal cavity, and then gets converted into speech. Easy way for you to understand is think of all the Hindi movies where you want the villain to stop speaking and the threat is Zaban खींच लेंगे. They don't say vocal cord खींच लेंगे, laryngectomy कर देंगे, ज़बान काट देंगे. And yes, we have seen hit movies where the villain's tongue was cut off, depriving them of the ability to speak. So if speech and voice are different entities, speech therapy and voice therapy are different also. And in this particular video, with the help of two examples, we will talk about the difference between voice therapy and speech therapy, and hopefully after watching this video, you will never think that speech therapy and voice therapy are synonymous, and you will know exactly what to prescribe in which conditions. So let's get into it. Let's start with the first disease. This disease is called puberphonia, also known as mutational falsetto voice. What do we mean by this? This is voice typically seen in males which does not sound like typical male voice. It does not sound masculine in nature. These patients typically are young males who have, for lack of a better word, a feminine voice, a high-pitched voice. They may talk like this. Maybe they are communicating in this way. Why are they talking like this? Is it a choice or is it a disease? It most certainly is a disease, and you need to take these patients seriously and treat them with the appropriate degree of empathy. Why should you take them seriously? This is not funny. This isn't a joke. They are actually suffering from a disease, and they are also, in all likelihood, suffering from a very poor self-image because they may be subject to a lot of mockery by people at work, by their peers, and even at home possibly. So you should treat them with the appropriate empathy and understand why this disease has happened. Some associated factors, apart from the demographic characteristics of the patient, such as the young age, such as the male gender, other factors associated with these patients may be some sort of psychological trauma in their childhood. They may be more attached to their mothers, and usually, to borrow a phrase from the textbook of E.N.T, they may shun traditional male responsibilities. Now, in today's world, there probably is no such thing as a traditional male responsibility because we live in a liberalized society where all genders are equal. But there are these old school traditional male responsibilities that these patients typically are not ready to take on. So this is a psychological problem. However, you can perform a clinical maneuver in the office which can demonstrate to the patient that their voice need not be permanently high-pitched. What is that maneuver? This maneuver is called Gudsman's test or Gudsman's maneuver. So before you perform the maneuver, you need to understand where voice is coming from. Voice is coming from largely the true vocal cords or the vocal folds, and the theory of phonation is called aerodynamic myoelastic theory. What is that? Basically, the voice box works like a wind instrument. When we are breathing, the vocal folds open up. It is called abduction. It creates a space for air to enter, and when we are breathing out, these wisps of air pass between the vocal folds, and this passage of air in between the vocal folds produces what we know as voice. If we are coughing, we are basically expiring air, but it produces a loud sound. This is also voice. This is voice. When I describe it, it becomes speech. I have talked about it earlier. So what we have understood is that vocal folds are the part of the body that plays a critical role in voice production. Now if you imagine a tightly strung wire, it is likely to produce a higher pitch sound. If the wire is slightly loose, the pitch reduces. A feminine voice has a higher pitch. A masculine voice has a lower pitch. So what we need to do is we need to try to reduce the length of the vocal folds. We can do it clinically because we know what are the two attachments of the vocal folds. The forward attachment or the anterior attachment is the thyroid angle, which is basically the midpoint of the thyroid cartilage. The thyroid cartilage we can feel on our neck. It is the most prominent part of the neck in males, also known as Adam's apple. So that is the anterior attachment, and posteriorly vocal folds are attached to vocal processes of arytenoid cartilage. In the office, you can touch the thyroid cartilage. You can push it backwards and downwards. The moment you do this, you can see that the voice changes. It becomes more lower pitched, and it doesn't hurt the patient if you know how to perform the test. But the patient realizes immediately that their voice is not permanently high pitched. This is called Gutzmann's test or Gutzmann's maneuver, where you are pushing the thyroid cartilage backwards and downwards gently. Once you have performed this test and you have understood that there is nothing wrong with the thyroid cartilage per se, the treatment is largely voice therapy, because you could understand their speech. It was just the quality of the voice that requires remedying. So voice therapy is the treatment in puberphonia, along with a little bit of psychological therapy, because the patient is suffering from a poor self-image because of their voice. So a combination of voice therapy and psychological therapy is the treatment in puberphonia. In certain situations, puberphonia may require surgical correction if these modalities don't prove to be satisfactory, but usually, in my experience, I have seen speech and language therapists play a fantastic role in helping people suffering from puberphonia regain their confidence and a good masculine voice effectively. Now let's talk about a disease which requires speech therapy. So of course it has to be a speech disorder such as stammering, also known as stuttering. What we have to understand is all children have a high-pitched voice to begin with. That changes into a masculine voice during adolescence in males. When it does not happen, it leads to puberphonia. Similarly, all children stutter when they start to speak between roughly the ages 2 to 4 years. Some children continue to stutter throughout their lives and most don't. What happens that perpetuates these stuttering habits in some young children? It is over attention to their stammer. If the parents, if the friends, if the siblings, if the peer group continuously points out that look at that child, he is stammering, look at his cute stammer, it reinforces the stutter, and children keep stuttering throughout their lives, and it leads to big issues. Not only do they have trouble speaking, but when the stutter becomes well established, they start exhibiting other facial tics like grimacing, like moving their heads, like nodding their heads, because they are struggling to get the words out. This is also a psychological problem, but the treatment mainly is speech therapy. So the key thing is to educate not just the patient but also their family members not to pay too much attention to a child who is stammering, because every child stammers when they learn to speak. Don't pay too much attention to it, don't mock them, don't make fun of them, and they will not stammer. But if it has developed, it can be recovered with the help of speech therapy and proper patient education. So there you have it. I have illustrated the difference between speech therapy and voice therapy with the help of Examples: puberphonia and stuttering. A very common instance where I have noticed stuttering is during exams, the Viva VOCE exams, because in stressful situations, students do stammer. Even I stammer when I record a video without the benefit of a teleprompter. That is not a permanent stammer or a permanent stutter. It is just momentary due to the stress of the moment. So if you make the child's life stressful by continuously pointing out that they are stuttering, that stress becomes ingrained and so does their stammer. I hope I've been able to explain the two diseases and their treatments in a lucid manner, and I hope you enjoyed this video. Take care, bye bye, and as always, please don't forget to be awesome.